You all for tuning in to today's virtual town hall meeting. I want to begin by thanking our speakers, Sheriff Anderson, Chief Demery, Matt Johnson with Mercy One Hospital, Kara Dickerson, also with Mercy One Infection Prevention, Mike Vogel, Fire Chief, Katie DeVole, Captain of Centerville Fire and Rescue, Mike Lamb with ADLM Emergency Management, Mark Waits with the Appanoose County Board of Supervisors, and Jason Frazier with the City of Centerville. And I'm Chris Larson with Appanoose County Public Health. Everyone will have a few moments here to speak about how their agency is altering daily activities in response to COVID-19. Currently, here in Appanoose County, we still only have had the one confirmed case of COVID-19. The person tested positive on March 25th and passed away on April 5th. Appanoose County Public Health's role is to share information from the CDC, Iowa Department of Public Health, with businesses, schools, daycares, religious organizations, and community members. We perform contact tracing to identify people who may have come in contact with an infected person, and we're here to answer questions or send people to the appropriate entity who can help guide them. I would like to thank everyone in our community who has diligently covered your cough, washed your hands, social distance, and stayed home when you were sick, and for staying home in general. Thank you. You are making a difference. Now, I would like to ask our public health nurse, Rhonda Tissue, to speak about why we are taking these additional precautions with COVID-19. Go ahead, Rhonda.
Thanks, Chris. We've got a lot to cover today, but I just wanted to take just a minute just to talk about a question that I get a lot, the differences between the flu and COVID-19. First of all, there are similarities. They are both viruses. They also affect your respiratory system. Their symptoms are similar: dry cough, fatigue, shortness of breath, as well as the transmission, close contact via droplets expelled by coughing or sneezing or even talking. Hence the reason for social distancing. But there are differences. The First and foremost, the influenza has a vaccine, and it has been used for many years. COVID-19 is new. We have no vaccine. So, we're trying to fight something without a weapon, basically. The flu will spread to 1 to 2 people, where COVID-19 can spread from 2 to 3 people. It doesn't sound like a lot, but it really is huge. Again, there are no vaccines for COVID-19. The treatment there is an antiviral treatment for the flu, but there is not, at this time, there is not one for COVID. COVID will affect the elderly and people who have other comorbidities, diabetes, heart disease, and we have no way to combat that. The last thing I want to talk about really quickly is the strain it puts on our healthcare system. The length of hospitalization for someone with the flu is usually 5 to 6 days. Coronavirus, the average is about 11 days. That's 11 days in a hospital. That is putting a strain on our healthcare system. So, all of that being said, I just encourage everyone to please try and follow social distancing guidelines. Stay home if you're sick. Just stay home if you don't have to go out for anything essential. And when you're out and about, I do encourage people to wear masks. The homemade masks are wonderful. Cover your cough. Only one person in the family needs to be out at the grocery store and such. We've been saying this for a long time, and so I just encourage everyone to kind of keep up the good work and keep up doing what you've been doing as far as trying to prevent this from spreading more. So thank you guys for listening, and I'm going to turn it over to Gary Anderson now with the Sheriff's Department.
Thanks, Rhonda. Good morning, everyone. Status from the Appanoose County Sheriff's Office currently right now, as I've reported before, currently we have the Appanoose County Law Center closed from the public in regards to just walk-ins. We still are answering calls as normal, with the exceptions that we are utilizing a 6-foot distancing when we're serving papers. When we're taking calls, we still have, if you want to call curbside answering, if we have someone that shows up at the law center, we can either handle that call by telephone, or the deputies will meet with that person outside of the law enforcement center. In regards to inmates, we currently right now have 18 inmates in custody. We're doing screenings of those inmates. We're also doing some initial isolation of new inmates that are coming in, temperature checks, keeping them isolated from the general population. Once they show no signs, symptoms of any type of disease, whether it be influenza, the regular flu, or common cold, then we move those to general population. As far as the inmates, we are trying to observe the CDC and the National Corrections Healthcare guidelines on what has been called as cohorting, which causes an issue with inmates and jail staff, that if we do have an inmate that needs to be isolated, we only have 2 cells that we can isolate those inmates. For example, the current facility is a linear style jail, which means if we have inmates in one cell, we have to have another cell empty between those inmates so that we can avoid cohorting and cross-contamination. Currently, right now, we're sitting good in the jail on personal protective equipment. However, if we do have an increase in exposure, we would run into a situation where we would be lacking personal protective equipment in the area of gowns. We have had those ordered, but like everyone else, it's taken more than 30 days for us to get those gowns. We're sitting good on disinfectants. We're sitting good on wipes and alcohol and sanitizers. As far as the weapon permit section goes of the Sheriff's Office, we're continuing to operate with renewal of weapon permits and new weapon permits. The only thing that we've changed is now everything is either done by the telephone, or once a person comes to the law center, they hand everything through a slot in the door, so there is no physical contact with that person face to face. Sex offenders are still continuing to be required to register and renew their sex offender registration with the Sheriff's Office. We're doing that over the phone and very limited face-to-face contact with that person outside of the building. On the civil side, all sheriff sales have been either canceled or continued under the proclamation from the governor's office until June. Forcible entry and detainers, which relates to evictions, has also been continued and canceled till June. As of right now, under the governor's proclamation, our primary goal right now is to continue the patrols. We are continuing to patrol all the rural areas of the county, also a lot of the local communities throughout Appanoose County, and to support Appanoose County Public Health and to educate everyone that we can under the direction and guidance of Governor Reynolds and her proclamations. One thing to note, that we have seen a decrease in calls for service. Chief Demery will speak a little bit on this, but countywide, we've noticed a 15% drop in the calls compared to this time last year. We're also at a 45% drop in the amount of bookings in the jail, and a 32% drop in the number of arrests compared to this time last year. Obviously, one of the things that we see that will take place is once the proclamation is lifted, we're going to see a dramatic increase. We still have several warrants that need to be served. We've had a lot of questions about why aren't some of these people being picked up on warrants. There again, we have 18 inmates currently in our custody. If we end up having
a red box or orange box right there, help show.
inmates are transferred to another facility and they do not accept those inmates, we're going to be stuck with those inmates. We're nowhere to house them. Also, the court system has instructed us to set all court dates at least 90 to 120 days from the date of violation. So once the judicial system is back open, we're going to have another backlog of cases that are going to have to be dealt with at that point in time also. The federal government has also shut down a lot of grand jury indictments and federal prosecutions. So we do have inmates under the federal side that are status quo and we're holding until the federal government opens the judicial system back up on the federal side. I'll turn it over to Chief Demery this time.
Thanks, Sheriff. On behalf of the police department, our calls for service are significantly down, which I think is a good thing for our community. They're trying to do their best to stay in, maybe not get involved in so many things as they were in the past. We are also doing the majority of our calls for service by phone and or in person at the front door outside in the parking lot. We're trying to limit the amount of exposure our officers do in person. If it's a serious type crime that would need more investigation, we would still send our officers out, as well as on traffic collisions, things like that. We're still not doing golf carts, bicycle licenses, anything like that at this time. Our normal patrol as well, we've been keeping that up. We've actually ramped it up a little bit at nighttime, just for the fact there's not as many people out. So we've tried to keep our patrol moving a little more frequently at nighttime. PPE wise, we're sitting as good as we can at this point. I think we're okay with all of our employees for now. If things change, we would maybe need to look a little further, but at this point, we're sitting pretty good. We're also at full staff. That's on the police department as well as the dispatch. Nobody is showing any types of signs or symptoms or anything of that nature, so we're good in that regard. We're trying to provide any updates to our staff pretty much on a daily basis. Anytime we get something new from county health or the state health or from the governor's office, we're trying to pass that along so everybody is where they need to be there. If you were to have to call dispatch on a 911 needing an ambulance or a law enforcement officer in an emergency, they are going to ask a series of questions in regards to the COVID-19. So I would just ask the public to be prepared for that. And then we get a lot of questions about being out in the public and doing certain things. And our stance has pretty much been, we're going to follow the governor's recommendations. That's kind of the information that I try to portray to people. Staying home as much as possible, limiting your exposures, maybe not going out and doing some things that we want to do or maybe would be fun right now, but let's try to hold off on some of that until this passes, and then we can get out and enjoy ourselves a little more. We're just here to help in any way needed, shape or form, whether it be with the Central Fire Rescue or the Public Health or ADLM. And with that, I'm going to turn it over to Matt Johnson with Mercy One.
Yes, thank you, sir. I'd like to thank everybody that's on the call today, as well as the community, especially Chris Larson and Mike Lamb, who have been so great to work with as we've continued to move forward. We've been in daily contact with Mercy One Incident Command. It's been a wonderful resource for us as we prepare for ourselves down here in Appanoose County and the Centerville region. Been a wonderful asset and continue to be very important in our family. As we continue to move forward, we continue to prepare and plan for all types of options for in terms of improving safety initiatives within the hospital environment. We've had a progressive rash of incidents in terms of initiatives, I would say, that where we are trying to protect our employees and our patients and community as we move forward. From a PPE update at the hospital, we are doing fairly well. We have a 2-week supply of PPE at this time. We continue to get different opportunities in terms of filling that through either Des Moines or emergency management. We enjoy those partnerships. Obviously this is a significant challenge We basically flipped our operating model from encouraging patients to come over, and then really transitioned it to a public health initiative where we're really trying to keep patients away in the best interest of flattening this curve. As we go forward, we will continue to examine when are the appropriate times to start to add services back in. We've already begun a plan to kind of ascertain what those initiatives look like in the timeline. We've had a very good planning session with our partners in Des Moines and locally as to what a surge would look like at the hospital and how we would accommodate any type of possible surge of patients. I think we have a good plan when it comes to that. Additionally, we're looking at the same instance on how do we plan to open up elective procedures and improve our capacity with specialty clinics, et cetera. At this time, we are doing only 2 specialty clinics. We have one oncology and nephrology clinic that's going at this point. From primary care, we do have our quick care continue to be operational in that way, as well as the regular family medicine clinic. We are doing a number of telehealth services, and we're doing some drive-up testing for patients that have been screened through our clinic at this point. So, at this time, we continue to have no visitors except for emergent issues as well as end-of-life scenarios. So that's kind of an operational update with where we're at the hospital. Do we know who's next?
Chief Bogle, if it looks like we may have lost his audio.
No, I'm here. Okay, this is Chief Bogle, Centerville Fire Rescue. Just an update, much like Chief Demery and Sheriff Anderson, we are down a little bit in the number of calls we've responded to. But some of the things, just to remind the public, some of the things that are going to happen when you call for an ambulance. The first thing, you will be asked a series of questions by dispatch about some of your health issues and some different things of that nature. We ask people to be 100% honest. The ambulance is still going to arrive and we're still going to treat you and transport. We just want to make sure that we're all taking the proper precautions, both for your safety and the responders. Initially, when you make patient contact, when the responders make patient contact, they're going to apply a mask to the patient. It does not matter if that patient's complaint is a broken ankle or a severe cough, they're going to be issued a mask and it's going to be applied to them. So please don't take offense to that. You will be asked by dispatch to meet the EMS unit if possible outside of your residence, weather permitting. Unfortunately, we've got a little colder again, but weather permitting, and if you're physically able, you're going to be asked to meet the EMS crew outside. You're probably only going to be met by one responder to do the initial evaluation and determine what level of care and that type of environment, and just to limit the exposure of the responders. Then determining what the proper procedures are, they may call medical control, which would be the hospital, and talk to them about whether there's a necessity to actually transport or if there's some things that you can do on your own at home. Again, we are going to show up, but there are some procedures in place to talk to you and educate the public and maybe limit the exposure of, again, the public to the hospital and the hospital to the public. When it comes to sanitizing, all of the EMS equipment and ambulances are sanitized at least twice a day, regardless of use, and they are sanitized after every response. So we're cleaning everything as much as we can. From the fire department standpoint, we have suspended all inspections, business inspections, and home safety audits. Much like the Appanoose County Law Center, the Centerville Fire Station is closed to the general public. If you do have an issue or a question, feel free to contact us either by phone or email with any questions. Other than that, we're much like all the other organizations. We're trying our hardest to keep everybody safe. We are at full staff. Again, and if you have any questions, please contact the fire station. Now I'm going to turn it over to Mike Lamb with ADLM Emergency Management.
Hello all. I'd like to say thanks for everybody that's attending the call today and all my partners out there that have worked very closely with my agency over the last few weeks to kind of get ahead of this in our local community. My agency is playing a logistical role right now to public health, healthcare partners, and all of our public safety and response personnel. We are trying to source through alternate sources outside of our normal supply chains the required PPE, distributing PPE that we're receiving from the national stockpile and PPE that's been purchased by the state of Iowa with some of the Stafford Act monies that have been awarded to us through the federal disaster declaration. So really just on a logistical and information sharing role, been working with all my 4 counties, not just Appanoose County, to basically make sure we're prepared. It's been a learning curve for us all, but we're all taking this very seriously and trying to do the best we can to ensure that we can provide the response needed if we were to become medically surged at any time within the community. So with that, my office acts like the conduit a lot of times for information directly from the state EOC back down to local municipalities and the county governments, as well as public safety. So we do have the local emergency operations center is stood up for all 4 of my counties because of the difference of this over any other natural disaster. We are doing it virtually instead of face-to-face to try to keep all of our public safety partners and our elected officials distanced, so we're not in the same room, so to speak, like we normally would be making decisions. So with through technology, we've kind of overcame that issue. It seems to be working. And with that, that's basically the role I'm playing and what we're doing for emergency management in Appanoose County. So, and my other 3 counties as well. With that, I'll turn it over to, I believe, Mark Waits with the Appanoose County Board of Supervisors.
Good morning. I just want to take this opportunity. Good morning. Just want to take this opportunity to thank the partners that have worked so diligently during this COVID-19 problem that we're facing. The Appanoose County Courthouse has been closed to the general public since March 17th. But the county is still operating. The county government is still operating from 8 to 4. Sorry about that. Am I still muted? Okay. Showing up on my screen here that I'm muted, I'm sorry. But the county is fully staffed. One of the things that happened last week was due to the governor's proclamation that our county parks have been closed. Leo Bradley and Sharon Bluffs camping has been closed. The nature center is also closed. But Phil wanted me to tell you this morning that the walking trails are still open, so you can get out and walk. But remember to keep your social distancing. Secondary roads is open and operating. We're working in groups of 3 only to keep the social distancing, and all the equipment is being sanitized at the end of the day. The treasurer's office is not doing not issuing driver's license at this time or doing driving test. The recorder's office is still open and operating, but you will need to call before you stop by the courthouse. And the assessor's office is also open and operating. But you need to come to the east door of the courthouse. The phone numbers are posted on the east door to reach out to these offices, and they are willing and want to serve the public, but we want to keep everybody safe. There's a lot of stuff that can be done via mail or online, but one of the things that is going to happen still is our June 2nd primary is still on. The polling hours will be from 7 to 9. But they're being consolidated into, Appanoose County is being consolidated into 3 locations to help reduce the risk to the poll workers and the general public. Because of this consolidation, we are encouraging you to vote absentee or by mail. This is the safest way to operate and to vote in the primary election. The Secretary of State's office will send out absentee ballot requests to every active registered voter in Appanoose County. More information regarding the mailing will be released at a later date. To help ensure that you receive your absentee ballot request, you can make sure that you are registered is current. You can look at that at the Secretary of State's website or call the auditor's office. Voting by mail will begin on April 23rd, and in person, you can vote at the auditor's office beginning May 4th. To vote in the primary, in this primary, you have to declare your party either Democrat or Republican. So other than that, we're still doing business at the Appanoose County, and that is all I have. Thank you. And I'm going to turn it over to Jason.
Thanks, Mark, and thank you everybody for joining us on this web call. It's obviously a little bit different format than we're used to, and we've all had to make changes like this. This format highlights one of the big changes that we've had to make, which is all of our city meetings are now currently done via Zoom or via phone conference call. And that's a big change for us. And I know the Board of Supervisors is also bringing that component into their meetings separately. So if you do want to participate in our city council meetings, which occur on the 1st and 3rd Mondays of the month, the call-in information is available through media outlets. On the city website, we post the full agenda with that dial-in information, and that'll also be on our Facebook page. Usually about 3 days before the meeting is when all of that will be posted. We do welcome your participation, and we are still doing our public forum at the end of meetings and still holding public hearings as they come up. As far as City Hall goes, we've closed City Hall to the public, and this is a little bit more stringent maybe than the courthouse is. And the big reason for that is we're co-located with the EMS service, and we really want to protect them from being exposed to anything from an outside source because we want them to be able to treat people and not be ill. So a little bit different situation maybe than other government buildings and needing to keep people out. We have reduced our staff at City Hall. We are still operating our normal 8 to 4:30, but we have alternating shifts for most of our employees. So there will be somebody here to answer the phones at all times and be able to answer most of your questions. If not immediately, within 24 hours, we can get back to you. Our normal water bills will go out as expected. So we're anticipating sending those out the 25th. But as a city, we have waived the penalties and extra fees for late payment to allow people to have some more flexibility in paying those. Additionally, the library has been closed for about a month now, almost to the public, and as of last week, the governor has ordered it to halt operations, as well as a lot of our park play facilities, as far as that goes. We plan to do as much as we can to keep normal operations. Our public works staff is still working with normal operations with alternating shifts to allow for that. So you'll see a lot of projects still going on, and we're still anticipating there to be the major overlay project on Highway 5. It's probably been pushed back to a month or two as far as the start time. You'll see the water crews coming back into town probably here in about 2 or 3 weeks to do their major work that was already planned for the year. So we're trying to keep operations going as normal, and we will just continue to push through this. If you have any questions, feel free to call City Hall, and we'll try to get you an answer as quickly as possible to that. As far as paying water bills go, you can sign up for direct bank withdrawal. That form is available on our website at centerville-ia.org. You can mail it to us. We also have our drop box at City Hall, or there is Hy-Vee customer service also accepts payment with your bill. I think those are the major points that we want to cover. So I'm going to turn this back over to Chris at Public Health, who I think is going to open up to questions.
Thank you, Jason. Yes, now I'd like to open it up to any of the press in attendance, which includes Kyle with the Daily Iowegian, Russ and AJ down there with the pitch, and KBIZ. You can ask questions yourself, or you can ask questions through the comment section of Facebook. Thank you.
Okay, we had a question come in wanting to know how many people in Appanoose County have been tested at this point.
Okay, that's a fair question, and in fact, Kyle asked me that just last week, and I don't have a total number ever since they've started testing, but I gave Kyle at the Iowegian last Thursday. This would be for the period April 2nd through April 9th. We did 9 tests between the clinics and the hospital. So I will do my best to get a number of total tests, and then I'm going to try and get those numbers released every week, so everyone kind of knows how many tests are out there.
At this point, we still have just had 1 positive test, and that was before April 2nd. So those 9 tests would have all been negative.
That is correct. We had our first case was on March 25th, and unfortunately, our first death was on April 5th. So that's our one and only case.
One of my questions would be for the hospital specifically, and Matt Johnson. There's been some reports of some workforce reductions at the hospital, and with that, some concerns in the community. Explain the rationale behind that, and if cases begin to grow locally, how quickly can the hospital staff back up to respond?
Yeah, thanks, Kyle. Yeah, just like any business, we have needed to adjust our staffing according to our volumes. As I mentioned earlier, our business structure has changed basically overnight, where we're working more as a public health entity now rather than an acute care facility. Very similar to a lot of the hospitals across the state and the nation, we have had to reduce our workforce shortage temporarily. But our full intent is that those jobs would continue as we were able to ramp up operations. So, i.e., increasing our elective surgeries and procedures, as well as our specialty clinic services and the wide array of services that we provide through our clinic. We are planning for that. As I mentioned, and as I stressed to our employees, this is a temporary workforce adjustment. There were no positions terminated. There were no employees terminated. So our full intent is that we run a very lean organization already. And so our full intent is that those positions would be coming back once our market returns.
Another question we've had on testing. Um, is it still the case that the testing guidelines are pretty restrictive so that the general public is not being tested? The actual question was, are these tests being kept only for essential employees at this time?
Is that for me or Chris, Kyle?
Whoever feels like answering it.
Okay. From my standpoint, we continue to, follow the IDPH testing framework for Iowa. So currently, all hospitalized patients with fever and respiratory illness and older adults 60 years of age with fever and respiratory symptoms and chronic medical conditions. So your disease, heart disease, and immunosuppressive medications, chronic lung disease, and then persons of any age with any fever or respiratory illness who live in a congregate setting, i.e. a nursing home, assisted living, group facilities, dormitories, etc. And then healthcare workers and your normal essential services personnel, first responders, critical law enforcement officials, etc. But currently, as of last week, we were still doing all of our testing through the state hygienic laboratory. We continue to work with them, send tests there. Des Moines, Mercy, Maine is continuing to improve and increase the capacity for testing within the state and our region. So I look forward to additional testing resources being opened up in the very near future.
I've got a question I think probably best suited for possibly Chris. One of our viewers wants to know, just curious on the number of deaths due to the flu versus the coronavirus. Obviously, coronavirus in Appanoose County, we have one death listed as that. Do we have the numbers on how many flu deaths there were this year?
Russ, I believe the neighborhood of 24,000 plus flu deaths annually. That takes into account the entire flu season. Every year that number is in that neighborhood. Right now, we haven't had that number of coronavirus deaths or COVID-19, but we also got to remember that the very first case ever in the United States was January 21st. So it hasn't been here for very long, but it spreads fast and does have a high mortality rate.
When you say 24,000, that's obviously not in Appanoose County. Do we know how many people a year in Appanoose County typically pass from the flu?
I do not have that number. Rhonda, you don't have that number, do you?
I do not have Appanoose County. I can tell you Iowa. Right as of April 4th, we had 95 associated mortalities, cumulatively, all ages, and one pediatric.
And again, I want to be clear, that question came from one of our viewers, not specifically from me. But I do want to ask, I guess, of Chris or possibly Mike Lamb in this. At this point, we just have the one case. Are we safe to say that it's like we're sitting around waiting on a tidal wave here, that this is going to come to Appanoose County, and we are going to have a problem with this? Or is it possible that we will never see any real major issues with that because of being prepared, or are we just sitting around waiting on the tidal wave, basically?
Russ, I would love to say that we'll only have one case here in Appanoose County, but unfortunately, I just don't believe that's going to be the case. There's strong evidence of community spread throughout all the counties in Iowa, so I think we would be naive to believe that it's really not spreading within our community. That's why we want to continue to encourage the social distancing, the stay home when you're sick, the wash your hands, everything that you've been hearing solid for the last, seems like, year, but it's only really been about a month and a half. So.
That's all I have.
I have
Russ,
a
I'll
question.
address your question a little bit. We do know one thing about this, about the virus, that 80% of the people that contract it will have little to no symptoms. So it would be probably logical thinking to think that we do have it in our community already. When you watch the statewide spread map, you see the surrounding communities around us, the daily numbers of positive tests increasing. So just because we don't have the people presenting sick enough or in that testing range to the right locations to be tested doesn't mean it's not already in our community. So that's why the mitigation strategies are so important. The social distancing, the washing of the hands, and everything that IDPH and the CDC is recommending. Just because we've only had one positive case, I would really, really highly recommend the public to think that not to be complacent just because of that. We've seen that spread all across the United States from the hot spots that way. So I'm not going to say that we're going to be overwhelmed. I'm not going to say, I wish I had a crystal ball so I could predict that, but ultimately it's here.
I have one more question of my own and then two other reader questions. The first would be for either Mark Waits or Jason Frazier or both. Some cities, particularly in Des Moines, are already starting to see sales tax revenues decline. Both of your entities have begun work on a lost referendum. Do you anticipate changes to those plans as you go forward, and do you anticipate a major loss of revenue in sales tax?
I think looking at the sales tax numbers, that will probably, at least right now, are probably holding pretty steady because people are still shopping and going to stores. And I think data for Iowa has shown that trips to the grocery store and pharmacies have actually increased by quite a bit, although other sectors are hurting. So at least in the short term, I don't think local option sales tax is a concern. Hotel motel tax, that's one that's going to probably take a significant hit, even in the short term. And that funds a lot of community beautification projects, events throughout the community. That's our tourism fund, and both the county and the city rely on that. And I know a big chunk of the counties comes from like Honey Creek, and Honey Creek has completely ceased operation. So that's going to take a big impact. And I think we're coming up to what would be our tourism season with people coming down to Rathbun. That crowd likely isn't going to be here this year. So that's when we're going to see it, is not so much in the next 3 months, but probably looking 3 to 6 or even longer out than that.
Kyle, I concur with what Jason said on the local option sales tax. My concern is looking into the future is our road use tax, or the gas tax. I visited with the county engineer, and we're already anticipating a big drop in our secondary road funds that comes from the gas tax. We're also seeing a lag and I anticipate this when this is over, that it'll be made up, but we're in our property tax because of the situation. But I don't see a dramatic drop in our local option sales tax.
Thank you. Next one would be for Chris, I believe. What is the protocol in a business situation if an employee tests positive? Is that business closed? What's the cleaning and reopening look like in that scenario?
Okay. Currently, the businesses are asked to obviously fill out a form if more than 10% of their employees are sick. They would fill out a form that goes to the Iowa Department of Public Health, and we are notified. But in the case of just one employee, obviously we would want to make sure that employee does not come to work, that they stay home for, and Rhonda, help me out here, I don't have it in front of me, 72 hours without a fever, stay home for at least a week after the symptoms onset. And we would also want to be very mindful and careful of looking at anybody else that they were in contact with, that they work closely with at their job, and make sure they're not having any symptoms, and they may need to be home quarantining also.
I just want to pipe in really quick. That's 72 hours without one of the symptoms, any of the symptoms that presenting. That could be without a cough. That could be without a fever. It could be any of the symptoms, the achiness, the some stomach issues have been kind of coming up. So 72 hours. Free from all of those. And as far as fever goes, it has to be 72 hours free of fever without using a fever reduction medication, Tylenol, ibuprofen, whatever you choose to help reduce that fever.
Okay, and then we have a question from Geraldine Inman. She says they're a small family-owned and operated business that does not qualify for any state or federal grants due to the fact that they do not have employees. They have researched multiple possibilities. They want to know if anybody has recommendations on sources that they could seek out at this time.
Mike Lamb. Right now, there's several different state and federal options available, and they are as this is being developed, more and more is coming out daily for relief for small business. Right now, it seems like single-family proprietorship businesses are somewhat falling through the cracks, but there is some verbiage out there that they're looking into that, and from a state and a federal level. My recommendation, especially locally, would basically track the Iowa Economic Development website. They, as that comes due, or the new programs open up, they post those to www.iowaeconomicdevelopment.com. And it, as the CARES Act continues to roll out and opportunities are made available for business owners, that would be the local source, the one-stop shop, so to speak, to keep abreast of that. That would be my recommendation to Gerald at this time.
And we did have one more quick question that came in. We have the new quick test, I guess, where there's a result within 15 minutes. I know those are limited. Is there any prospect that the area will receive one of those tests?
Those are actually mobile. And so I would love to say definitely yes. Because it sounds like that, could be something that we could do. At this time, though, we don't really see that coming down here. But things change from day to day. So.
And maybe, Rhonda, it would be helpful if you could address, I guess, it seems like there's a misconception on, a lot of the questions we get are there test kits in the area? From what I've been explained by Chris, there really is just a swab for influenza. Is that accurate, or is there concern about so-called test kits in our area?
I don't know a whole bunch about the test kits. I do know that we are performing the tests, and it is the same swab that we would use for the flu to test for influenza. The difference is that we put it, we would put it in a different type of transfer fluid, I suppose. I'm not really sure how to explain that part, but then we send it to the state hygienic lab, and they're the ones who do the testing with that swab. So I'm not sure as far as that goes, if we're talking about kits. What we're talking about are the swabs. We definitely have plenty of those, and we definitely can send that to the state hygienic lab. There are different things that the Iowa Department of Public Health and the CDC are looking for as far as reasons for testing. But please know that your doctor, your physician, your primary care physician, has the ultimate. They have that call. They can make that call. They're the ones that can say, well, maybe you don't have a fever, and your cough is not really bad, but maybe you're complaining of just terrible aches. You're not a first responder. You're not high risk, but I'm still concerned. Let's go ahead and test. And we are seeing that all over the state, that primary care physicians are doing that.
Kyle, I'd like to follow up on that as well. The hospital has continued to remain. We have an adequate supply of testing resources, and have continued that over the past couple weeks. So we do have the appropriate swab and transport media. Those are obviously low on numbers from a statewide standpoint. And those are traditionally worked through the state hygienic lab. Many organizations, Mercy included, have really made a lot of ground in regards to testing on their own sites. So this is mainly more in the metropolitan urban hospitals than you would see in the rural facilities throughout the state. It remains to be seen, what that Abbott could do in rural facilities. Obviously, would take a considerable amount of time to ramp something like that before we get up. But a lot of ground amongst both Mercy and Unity Point, from a central Iowa perspective, that really improves access to testing in our region. With a lot of the hospitals connected to either of those hospitals in the area, we are able to move those, and I think in the next couple of weeks we'll be able to ramp that up as needed. Obviously, that's going to be physician or provider dictated at this point. I don't see any big changes in terms of how we are testing, but we have continued to maintain a supply. So just wanted you to know that.
If that's all the questions from everybody, thank you all for your attendance. I appreciate it. Stay safe out there and stay apart.